right to point out that every day up and down the land, thousands and thousands of police officers do remarkable things, and we should never forget that.
Sounds right, okay.
Can I welcome her back to the front bench? Shadow Home Secretary Javid.
Yeah. Thank you, Mr. Speaker. It's good to be back, if only on such a difficult, sadly on such a difficult issue. All our hearts will be with the family and friends of Anthony Walgate, Gabriel Cavari, Daniel Whitworth and Jack Taylor, as these were vile murders by a man who targeted young gay men, all found close to each other and close to his house. And it is incomprehensible that the dots were not joined. The juror's verdict that fundamental failings in the police investigation probably contributed to 3 deaths is extremely serious. 3 young men might otherwise have been alive today. The jurors heard damning evidence about lack of basic checks, lack of professional curiosity, serious workforce pressures, long delays on digital forensics, serious failures in leadership, and crucially, the victims' families have raised very serious concerns about homophobia blighting both the investigation and the way they, as partners and relatives, were treated, though the jurors were directed not to consider this. Rightly, the Met have recognised failings and are making changes, and we await the coroner's Prevention of Future Deaths report. But given the seriousness of this, does the Minister not agree a further independent inquiry will be required to get to the truth of how and why it was possible for things to go so badly wrong? And does he accept that the family need answers which they have not got right now on how far homophobia, prejudice or unconscious bias affected this investigation? I would say to the Minister, the Home Office response is too weak, given the seriousness of this. The Policing Minister and the Home Secretary have a responsibility to be relentless in pursuit of the truth, ensuring the families get the answers that they need and deserve. The IOPC will look at individuals, the HMIC at homicide procedures, Louise Casey at Met Culture, but none of them are addressing the full scale of what went wrong in this case, whether homophobia was involved, and what changes are needed, not just in the Met, but in police forces right across the country to make sure this can never happen again. Can I please urge him to look at this again?
Minister.
Well, Mr. Speaker, I obviously do recognise the deep concern about these investigations, not least, as the Right Honourable Lady pointed out, and I, of course, welcome her to her place, pointed out the seeming incomprehensible nature of the dots not being drawn together. I have to say this has often been a problem, not just for the Metropolitan Police, but for other police forces, where seemingly obvious patterns of behaviour have failed to be linked together in other types of crime. We did see it earlier in the Met, if you remember, in the case of John Warboys, a serial rapist whose pattern of offending was never pieced together. I am reassured that the Metropolitan Police have made significant changes structurally, aligning their homicide teams with their basic command units, their borough command units, so that there can be better coordination and making sure there is better analysis of patterns of offending to see early on if there are linked series of crimes. As far as her primary question on independent inquiry is concerned, obviously, as I say, the Deputy Mayor has commissioned HMI to look at the investigative practices. The Met have themselves commissioned Dame Louise Casey to look at their culture internally. The IOPC are considering whether to reopen in the investigations, and in the light of those 3 steps that we're looking at, we'll obviously have to keep the situation under review, but for the moment we'd like to see how they conclude.
Peter Gibson.
Thank you, Mr. Speaker. Can I thank my right honourable friend for his statement? Everyone is rightly horrified at the deaths of these young men. Reports of alleged institutional homophobia in the Metropolitan Police must be taken seriously. Can my right honourable friend reassure the gay community of London that he will support every effort to root out homophobia?
Minister.
Well, Mr. Speaker, I certainly can give that reassurance, and we will stand foursquare with the Commissioner herself as she seeks to do exactly that. Obviously, the Met have not stood still in seeking to address this issue. As I understand it, they do have a new LGBTQ organisational improvement group. They have a network now of 125 volunteer advisors across the whole of the Met. Officers being posted to a particular borough or a particular area are now being briefed much more and trained much more coherently about the nature of the community that they are dealing with, including obviously LGBTQ members of that community. They are making big strides, but nevertheless there will be lessons to be learned, particularly from Louise Casey's review, and we look forward to seeing those conclusions.
Carl Turner.
Thank you, Mr. Speaker. Sarah Sack, my constituent, Anthony's mother, was on holiday in Turkey when the Met Police contacted her to say that her son had been found dead. From that very second, Mr. Speaker, Sarah Sack accused the Met Police of prejudice to me, and throughout these entire proceedings, she's constantly made the point that there was discrimination. Sadly, the coroner chose not to look at that, and I make no criticism of the coroner. But when I spoke with Sarah last night, she said to me, what can the Home Secretary do to persuade her that this can never, ever happen again?
Minister.
Well, Mr. Speaker, obviously I offer my profound condolences to Sarah. As a father myself, I can't ever imagine having to go through that kind of experience. It must have been terrible. And I know in particular that there were failings in the posture of the family liaison officers, perhaps who dealt with some of the bereaved, which I know is also being addressed by the Metropolitan Police. Those people who know Baroness Casey will know that she will be unrelenting and forensic in her examination of the culture at the Metropolitan Police. I have confidence in her to do a good job on examining the overall culture in the Met, of which an examination of this issue will be part. And once she has concluded, we can then draw some lessons about the future.
Dr. Julian Lewis.
Thank you, Mr. Speaker. There's always a danger that an entire institution will be damaged by the failures of a few. However, what action is going to be taken against those officers found guilty of such an abysmal failure of investigation and drive? And if action isn't taken, then doesn't that create the narrative that there is something wrong with the institution as a whole?
Minister.
Well, Mr. Speaker, the Honourable Gentleman is absolutely right that people need to have confidence not just in the force as a whole, but in the individual officers that make it up. He may know that originally 17 officers, I think, were investigated by the IOPC. They concluded some time ago. However, it's my understanding that they are considering whether to reopen the investigation in full or in part in the light of the evidence from the inquests.
Florence Session-Loby.
Thank you, Mr. Speaker. My constituency, Vauxhall, is home to one of the largest LGBT communities in the country, and I share the dismay of many of my constituents over the Met Police's response into this horrific murders. How can my LGBT constituents trust the Met when they failed to link those 3 deaths so close together? How can my LGBT constituents trust the Met when they refuse to rule out some of those horrific homophobic presumptions about these young gay men? How can my LGBT constituents trust the Met when 12 months after the first murders took place, they ignored the police from family members, friends and partners? The Minister said that he's reassured by the Met. For my constituents, I don't think they're reassured this afternoon, Minister, respectfully. Whether it's with some of my BME constituents, some of our female constituents, it seems to be a catalogue of failure from constituents and communities from the Met Police. So will the Minister please show leadership, which he said is needed for this, to show that leadership and call for a full investigation, a public investigation, to get to the bottom of this? Yeah.
Well, Mr. Speaker, I obviously understand the Honourable Lady's anger, and it's anger and frustration that many of us feel. However, as I said, I am reassured that the Met are taking the 3 steps that are, I think, required to learn the lessons of this issue. First of all, they are acknowledging that something went wrong and have apologised. Secondly, they are being transparent about that and transparent about what needs to change. And thirdly, they are seeking independent advice on their internal processes, internal culture, to make sure that that change happens and sticks. I hope that over time, while I can understand doubts that many may have in the LGBTQ+ community about the Metropolitan Police today. I hope that that means that over the months and years to come they can rebuild the trust that is needed between those two.
Ben Bradshaw.
Mr. Speaker, the long-term partner of one of the murder victims was not allowed by the police to read the forged suicide note, of course written by the murderer, because he was not considered next of kin. That is the most appalling attitude that we left behind in the 1980s. And given, as my honourable friend says, this is the latest in a catalogue of abysmal failures by the Metropolitan Police that indicate a rotten culture at the Met's heart. Why did the Home Secretary recently extend the Met Chief Officer's tenure by 2 years?
Well, Mr. Speaker, obviously the Home Secretary felt, along with the Mayor of London, that the current Commissioner was the right person to do the job for the next 2 years. And of course, these awful events happened when I don't believe she was in the employ of the Metropolitan Police at the time. However, he makes a strong point about the culture of the Metropolitan Police, and importantly, that is something that the leadership have themselves acknowledged, hence the appointment of Dame Louise Casey.
Thank you, Mr. Speaker. An Ipsos Mori poll suggests that trust in the police has fallen from 76 to 63%, especially amongst marginalised groups and the LGBTQ+ community. So will he call, our Liberal Democrat call for mandatory UK-wide awareness training for the police on prejudice and unconscious bias?
Well, Mr. Speaker, the police obviously have extensive training at the moment on many of these issues. And while I do acknowledge that the trust and confidence in the police has taken a battering over the last few months, it's worth remembering that the people who are most profoundly upset by that are the thousands and thousands of police officers of all types across the country who want their profession, their vocation, to be held in high esteem by those they serve, not least because that's the primary motivation for them joining. The police service in this country is changing very significantly, not least because, as she will know, we're recruiting a new generation of police officers which will massively expand capacity, but also bring a new generation of mindset into the organisation. That presents an enormous opportunity, A, to diversify the police force, but B, also to see the kind of cultural shift, which I have to say, to be fair, has been ongoing for the last 20 years.
Jeremy Corbyn.
Something as appalling as this deserves a bit more than being tacked on to an existing inquiry. It surely requires a public inquiry, as other colleagues have called for, to look at the totality and the horror of this event. I noticed that the Minister mentioned the idea of specialist officers within the force. I understand the need for them and I can see some value in it, but isn't there a greater problem, and that is one of general attitudes throughout the force, and the danger of having specialist officers is things get shoved onto them, ignored by everybody else. What we need is a change of culture as a whole right across the Metropolitan Police Force.
Well, Mr. Speaker, obviously there is a strong role for specialist officers, particularly in particular aspects of investigation or investigations that have particular characteristics. I think the key thing is that those officers work hand in glove with other officers, particularly those who are based on a borough, and who very often are able to piece together the investigation in the way a specialist officer isn't. I know, for example, that one of the improvements that the Metropolitan Police is putting in place is better training for frontline response officers to make sure that they are able to follow an investigation basically from start to finish much more, and that only the most serious of crimes get handed off to the specialists in a way that is coordinated. And therefore the chain in intelligence and appreciation of what's happened, and the full picture, if you like, of what's happened in a related set of offences is not lost to the organisation.
Thank you very much indeed, Mr. Speaker. Well, indeed, it has been a terribly, terribly sad few days. And as my right honourable friend from Exeter has said, we did not expect in this day and age for a partner of a gay man to be treated in that way. Now, although progress has been made, it can still be extremely difficult
for members of the LGBT plus community to speak confidently about partners or relationships. So I'd like to ask the Minister what protocols he has put in place since these tragic events, not just in the Met, but across all police forces, to ensure that friends, partners and families of the LGBT community are treated effectively and sensitively in any form of investigation, and what is he going to do to ensure that those protocols are being effectively implemented and not just a piece of paper?
Well, Mr. Speaker, as the Honourable Lady I hope will know, the Police Crime Courts and Sentencing Bill, which is currently in the other place, but due to return to us in the new year, does contain in law the provision of a police covenant, one of the key themes of which is family support and welfare. As part of our engagement in building that picture, I was very pleased to participate with a number of groups of different aspects of policing. As I say, a great tapestry is there these days. It's not just a monoculture in British policing. And one of the key groups that I spoke to was those who are in an LGBT plus relationship, to understand the particular relationship they have with policing and the particular support that they may need for the future. I hope that as the Covenant lands, we'll be able to flesh out more widely what that support looks like, and she'll be able to support us in doing so.
Clive Efford.
Thank you, Mr. Speaker. The response to the government just smacks of the same old responses we have of shutting down shop when the police are criticised in this way. The IOPC investigated 17 officers involved in this investigation. Only 2 were disciplined, despite the scale of the failures in this investigation. And now we hear the IOPC are invited back to have another go. That really isn't good enough, and what's needed here is a fully independent inquiry, and it's time the government really recognised that that's the only response that's acceptable.
Well, Mr. Speaker, I understand the honourable gentleman's frustration, but I'm sure he would understand that it is extremely important that the IOPC relies on the eye, that they are an independent office for police conduct, and therefore that they cannot be ordered by ministers or anybody to investigate or not investigate. I am given to understand that in this case, in the light of the evidence that's come through, they are considering whether to reopen the investigation. Now, it would not be for me, it should not be for me, and it would not be proper for me to influence their decision either way, in the same way that it's not for me to order the police to investigate any individual or otherwise. So I think we should wait and see what they have to say. Wait for the other inquiries commissioned by City Hall and by the Met themselves, and then see what the picture looks like after that.
Chris Brown.
This incident extremely seriously, and we want to do everything we can to make sure that it doesn't happen again.
Can I just say that seems to be aimed at me, because I granted a UQ because there was no statement. Chris Brown.
Well done you, Mr. Speaker. The Minister has said repeatedly that he has reassured himself. Well, he hasn't reassured me. If anything, quite the opposite. He keeps on referring to this as a tragedy. It's not a tragedy. It's a double-layered gay hate crime. I wish he'd actually used those words. It's been a double-layered gay hate crime. First of all, the original murders, and then the refusal to investigate, which in itself is a gay hate crime. It's about time we took these seriously, not least because homophobic hate crimes for the last 3 years have risen. It's 1,833 a month. That's why a lot of gay men in this country are beginning to feel frightened. You've got to do something. Get on with it.
Well, Mr. Speaker, first of all, apologies. I was not aiming any particular comment at you. It's just the microphone went off as I was just finishing. Look, I acknowledge the terrible nature of this crime, and I acknowledge the prejudiced, homophobic nature of it. Yes, I do. Absolutely, of course I do. And as he will know, we're doing enormous amounts of work on violence and murder in all its forms across the whole of the country. We've set murder specifically, irrespective of the nature of the murder, as one of our national priorities to push it down. Now, obviously, this murder is particularly heinous and particularly unpleasant, not least because of the botched investigation that took place around it. What I'm saying to honourable members on the opposite side is we are determined to help the police learn the lessons from this. We will do what we can to help them to do so, to push them to do so. At the moment, we don't believe that a full public inquiry is the way to do that, not least because of the time required. But we do believe there are some extremely useful and assertive investigations ongoing independently around this case, which do give us some cause to believe that there will be change in the future. Now, if there isn't, we can come back to it in the future. But please, honestly, Mr. Speaker, I hope nobody is implying that either I or the government don't take these kind of crimes extremely seriously. We absolutely do. Every single murder that happens in this country, no matter the complexion or the demographic of the victim, is of extreme importance to us and to me personally.
Luke Pollard.
Thank you, Mr. Speaker. Homophobia is a lived reality for thousands of gay people up and down the country every single day. These avoidable murders of gay young men will be broadcast around the country. LGBT people will be looking at it and looking at the Minister's response and says, they do not value my life because I am gay. A full public independent inquiry will give LGBT people the reassurance that something will be done to stop this ever happening again. Will the Minister reconsider his refusal to have that independent inquiry?
Well, Mr. Speaker, I have to confess I object to this characterisation that I don't care or that we don't care about these individuals. It's completely unfair and completely untrue, and particularly, not least, of course, to those members of the government who happen to be of that description themselves. Many of us have worked on these issues, addressing all sorts of communities, whether it's the domestic murders, murders in minority communities, murders of all sorts of people are profoundly important to us. That's why we set murder as a national priority. That's why we are working particularly, I mean, just if it's of interest to the House, last week I got the 7 police chiefs of the 7 biggest contributors to the murder total in this country round a table to talk about how we can further drive murders down of all types. Now, this is a particularly unpleasant murder. I understand the alarm and the distress it will have caused across the country. And we need to learn the lessons from it, and we are determined to do so.
Andrew Slaughter.
Thank you very much, Mr. Speaker. The Minister's response to my friend's urgent question, which should have been a statement by the Home Secretary, is extremely disappointing. I've dealt with the Met for over 30 years as a lawyer as well as a politician. I can remember very few cases as serious as this, both because of the callous incompetence of the investigation and the consequences and the loss of lives of those young men. And all I've heard from the Minister today and from the senior members of the Met, who were just London MPs are just about to go and talk to, is platitudes. Yeah. Platitudes specifically because they will not address the homophobic nature of these murders. They aren't being addressed because they will not be included in the inquiry, and he will not include a full inquiry. He needs to order that now. There's a BBC series starting on the 3rd of January on this. This isn't going to go away. He's entitled to his view that the Met aren't institutionally homophobic. I would take a different view. He's not entitled not to investigate that and to sweep this under the carpet.
Well, Mr. Speaker, first of all, it is not the case that this matter is not being investigated further. As I've outlined several times now, there are a number of lines of inquiry that are being pursued, both about the Met's investigation generally, their culture more specifically, and the IOPC may or may not reopen the investigation into the officers. Right? So it is not the case that this has reached some kind of dead end, as members on the opposite seem to be implying. And it is simply not true that we are not bending every sinew to try and identify those who are likely to murder in all different circumstances, whether that's domestic or through drugs or whatever the circumstances are. And in fact, as I say, just last week, I sat the 7 biggest forces down. We had a 3-hour session to look at what more work we could do to identify those who are likely to go on to commit this kind of crime. What is their precursor behaviour? What indications are there in their background? What data pools could we put together, whether that's their background offending or intelligence about them, that would give us clues towards what they were likely to do and allow us to intervene before? Now, that is an enormous project of work that's been underway for 2 years now, and I hope and believe that it will drive down murder numbers over the next few years to come. But please, I think it's very unfair to accuse us of not taking these murders extremely seriously. That is exactly what we are doing, and we're determined to make sure that they don't happen again.
Dr. Rupert.
Mr. Speaker, Daniel Morgan, Bieber Henry and Nicole Smallman, the Sarah Everard case and then the resulting vigil, the fiasco at Wembley, and now this shocking set of, and the Minister hasn't said the word gay, murders. The list of bunglings, I don't think he has acknowledged it's... Anyway, the list of bunglings, Mr. Speaker, under this Metropolitan Police Commissioner this year alone seems endless, and it's a history that dates back to 2005 with the shoot to kill John Charles de Menezes operation. Can I ask that, as well as the inspection that he mentioned, he undertakes a full statutory inquiry with teeth into the entire Met Police and, sorry, it might sound unsisterly to say so, its leadership. And that also should be a priority for whoever it is that steps into my right honourable friend's shoes on the committee on Wednesday.
Minister.
Mr. Speaker, for the avoidance of doubt, these were very obviously horrific gay murders targeted against men because they were gay and driven by who knows what, but homophobia, some kind of depraved sexual practices, I do not know. But some monster perpetrated these awful acts against these poor gay men. And I'm happy to say it without reservation. Obviously, they need to be investigated, and obviously we need to get to the bottom of it. As I've explained earlier, there are inquiries ongoing into the culture of the Metropolitan Police. I would like to see how they land before we seek to duplicate them by some other means.
Andrew Gwynne.
Thank you, Mr. Speaker. We should not ever underestimate the very real concerns of the LGBTQ plus communities across this country at these dreadful failings by the Met Police. Can I ask the Minister if he is satisfied that police forces across the country, not just the Met, have sufficient time, resources and leadership to ensure that the complete breakdown of oversight described by the jury in this hearing cannot ever happen again?
Mr. Speaker, as I said earlier, much of my work over the last 2 years has been devoted to bringing the focus of the whole of UK policing, and in particular its leadership, onto murder as a specific issue. That means improving processes, improving forensics, improving their investigation techniques, and improving their prior identification. But critically, it means improving the leadership. And that's what I was doing last Thursday with the police chiefs from across the country.
Finally, Jim Shannon.
Thank you, Mr. Speaker. Can I thank the Minister for his response to the questions? But I have to ask him this. Minister, having read some of the details of this case in the news recently, I was, as others are, very, very shocked, and am, like many others in this chamber and outside this chamber, anxious to understand why normal procedures do not seem to have been followed. So can the Minister affirm the fact that for every case based on any crime with any motivation, the inquiry and the evidence procedure is the same, and that there are no levels of importance within allocation of cases in any of our police forces in the United Kingdom?
Very good, James. Well, Mr. Speaker, that is definitely the consistency that we seek. But in particular, there is a category of deaths which have thus far needed some focus, and that is unexplained deaths. So, for example, in these circumstances, obviously these deaths were originally classified as unexplained or non-suspicious. Since then, I understand the Metropolitan Police have put in step-by-step guide for officers to make sure that in contemplating these deaths, no stone goes unturned in trying to connect them, in trying to make sure, ascertain, be forensic and curious about whether they could be linked in the very obvious way that many of us have read in the papers. These were in fact linked, whether by geography or by causation. I hope that that will improve the investigation of these, and that we will see that consistency that he seeks across the whole country.
That completes the UK. Before I call the Secretary of State for Health and Social Care, I want to put on my record my disappointment that the Prime Minister is not here to make this statement. Can I say, last night in front of Secretary of State for Health, he phoned me to say that the Prime Minister felt the need to make the announcement to the country yesterday. but I'm surprised that he did not therefore think it appropriate to come to this House to answer the question on the important announcement today. I've got to say, I always have the respect for the Secretary of State for Health, but I am really disappointed that once again this House has become second runner-up to TV news. Not acceptable. This is the game we're going to play. We're going to have to play hardball. Secretary of State for Health, statement.
Mr. Speaker, with permission, I'd like to update the House on COVID-19. Since the UK became the first country to approve a vaccine against COVID-19, which was almost exactly a year ago, we've been locked in a race between the virus and the vaccine. The success of our national vaccination programme has moved us ahead in that race. But now, with the new Omicron variant, we have to work even harder to stay ahead. Since last week, we've learned two things about this variant. The first is that no variant of COVID-19 has spread this fast. There are now 4,713 confirmed cases of Omicron in the UK. And the UK Health Security Agency estimates that the current number of daily infections are around 200,000. While Omicron represents over 20% of cases in England, we've already seen it rise to over 44% in London, and we expect it to become the dominant COVID-19 variant in the capital in the next 48 hours. There are currently 10 confirmed people in England who have been hospitalised with Omicron. It's vital we remember that hospitalisations and deaths lag infections by around 2 weeks. So we can expect those numbers to dramatically increase in the days and weeks that lie ahead. In preparation, the UK's 4 chief medical officers raised the COVID alert level to 4, its second highest level. This was done over the weekend. And NHS England has just announced that it will return to its highest level of emergency preparedness, level 4 national incident. This means the NHS response to Omicron will be coordinated as a national effort rather than led by individual trusts. The second thing that we've learned in the past week, Mr. Speaker, is that 2 jabs are not enough to prevent symptomatic infection from Omicron. But a third dose, a booster dose, provides strong protection, with analysis by the UK Health Security Agency showing a third dose is 70% effective at preventing symptomatic infection, and we expect the booster to take effect more quickly than the second dose. We're already running the most successful booster campaign in Europe. Over 4 in 10 UK adults have now received a third dose or booster. And Saturday was a record, with over 500,000 boosters given across the UK. But, Mr. Speaker, with the race between the virus and the vaccine so close, we must move faster. 2 weeks ago, we announced that we would offer every eligible adult a booster by the end of January. But in response to the Omicron emergency, and as the Prime Minister announced yesterday evening, we're bringing that target forward by a month and launching the Omicron emergency boost. We've opened the booster programme to every adult who's had a second dose of the vaccine at least 3 months ago to offer them the chance of getting their booster before the new year. So from this morning, anyone over 18 can walk into a vaccination centre, and from Wednesday, they can book online via the NHS website. The UK government will also provide whatever support is needed to accelerate vaccinations in Scotland, Wales and Northern Ireland. We have the jobs. The challenge now that we have the jabs. The challenge now is to get them into the arms. To meet our ambitious target, the NHS will need to deliver a record number of jabs. Until now, the highest number of jabs that we've delivered in a single day in the UK was over 840,000. We'll not only need to match that, but we will need to beat that every day. But we can, and we've got a plan to try and do it. We're opening more vaccination sites, including pop-up and mobile sites, that will be working 7 days a week. We're training thousands more volunteer vaccinators. We're asking GPs and pharmacies to do more. And we're drafting in 42 military planning teams across every region of our country. Mr. Speaker, this collective national mission will only succeed if we all play our part. Those who haven't had their booster should find their local walk-in and vaccination centre, or they can book an appointment on the NHS website from Wednesday. Those who have had their booster jab should encourage their friends and family to do the same. Those who have or have recently had COVID should wait 28 days from their positive result to get their booster. And to those who haven't had their vaccine at all yet, Mr. Speaker, I would like to say this. Whatever has held you back in the past, please think again and book your jab as quickly as possible. By acting together to get boosted now, we can protect ourselves against Omicron this winter. Mr. Speaker, I acknowledge that our national mission comes with some difficult trade-offs. We are redeploying NHS staff away from non-urgent services. This means that, for the next 2 weeks, all primary care services will focus on urgent clinical needs and vaccines, and some urgent appointments and elective surgeries may be postponed until the new year, while we prioritise getting people the booster. These are steps that no health secretary would wish to take unless they were absolutely necessary. But I'm convinced that if we don't prioritise the booster now, the health consequences will be far more grave in the months that lie ahead. Mr. Speaker, our Omicron emergency boost is a major step, but I'm not going to pretend that this alone will be enough to see us through the difficult weeks ahead. Because of the threat of Omicron, we are moving to Plan B in England subject to the will of this House, meaning that we must use face coverings in indoor public places. People should work from home if they can, and from Wednesday, again subject to this House, you'll need to show a negative lateral flow test to get into nightclubs and large events with an exemption for the double vaccinated. Once all adults have had a reasonable chance to get their booster jab, we intend to change this exemption to require a booster dose. Even with Plan B, Mr. Speaker, we still have far fewer restrictions in place than Europe. I can also confirm, Mr. Speaker, that from tomorrow, fully vaccinated contacts of a COVID-19 case will now be able to take a daily lateral flow test instead of self-isolating. This is a vital way to minimise the disruption to people's daily lives and to avoid the so-called pingdemic. And I can assure this House that the UK has sufficient lateral flow tests to see us through the coming weeks. If anyone finds that they are unable to get a kit online, they should check the website the following day, or they can pop down to the local pharmacy and pick up a kit. And from today, I can confirm that the NHS COVID Pass is being rolled out to 12 and 15-year-olds for international travel, allowing even more people to be able to prove their vaccine status for travel where it is needed. From today. Mr. Speaker. Mr. Speaker, taken together, these are proportionate, balanced steps keeping the country moving, while slowing the spread of Omicron and buying us more time to get more boosters into arms. We're also taking steps to keep people safe in adult social care. And we know that, sadly, people in care homes and those who receive domiciliary care are more likely to suffer serious health consequences if they get COVID-19. So we're expanding our specialist vaccination teams to get more boosters to the vulnerable and those providing care. But even as we do so, we must go further to protect colleagues and residents from Omicron. So we are increasing the frequency of staff testing, and with a heavy heart, we must restrict every resident to just 3 nominated visitors, not including their essential caregiver. This is a difficult step, and I understand that it comes with an impact on physical and mental well-being. But we know that from previous waves that it's one of the most effective things that we can do to to protect vulnerable residents. We are also increasing our workforce recruitment and retention fund with £300 million of new money. This is in addition to the £162.5 million we announced in October. The funds will help pay bonuses, bring forward pay rises and for the care staff, and fund overtime and increase workforce numbers over the winter. Mr. Speaker, I know that honourable members had hoped that the days of this kind of COVID-19 update were behind us. After our successful reopening this summer, it is not an update that I wanted to deliver. But the renewed threat of Omicron means that we've got more work to do to stay ahead of this virus. We can if we all play our part, and boosters are the key. We've achieved so many phenomenal things over the last 2 years, and I know we are weary, but it's on all of us to pick up, to step up, and do some phenomenal work once again to play our part and to get boosted now. I commend this statement to the House.
Can I suggest to the Secretary of State we could be a pop-up site for all the staff that work here to get them boosted? Can I now come to the Shadow Secretary of State, West Streeting?
Thank you, Mr. Speaker, and can I thank the Secretary of State for advance sight of his statement. Today, Mr. Speaker, we learned of the first death in the UK as a result of the Omicron virus. So on behalf of the whole House, can I send our condolences to the friends and family of that person who's lost their life. Their death sets this statement and the task at hand in context. It is a stark reminder that the pandemic is not over, that the new variant is a clear and serious risk to our public health, and of the urgency of getting Britain boosted and protecting us against this threat. Mr. Speaker, the Labour Party will always act in the best interests of our NHS, of our public health and of our nation. Having repeatedly called for the booster programme to be ramped up, we will give our full support to this effort. And we on these benches will make every effort to get the message out that vaccines are the best tool we have at our disposal to protect ourselves, to protect those closest to us, and to protect our NHS. The target of getting 1 million people a day their booster vaccine is unprecedented, and it may even prove impossible. But we applaud the ambition. If anyone can do it, the NHS can, and the whole country will be willing them on and will not knock them for trying. What people will not accept is the government moving the goalposts. The Prime Minister is now famous for over-promising and under-delivering. In his televised address last night, he said, and I quote, "People will have the chance to get the booster before the new year." But that aim is instead, as we've heard from the Secretary of State, is to offer the booster to every adult by the end of the month, meaning the delivery will wait until January or even February. Is the government now rowing back on the target set yesterday? If so, why has it changed overnight? And what hope do we have of achieving the level of booster jabs we need if the public and those delivering the vaccines are told one thing one day and another the next? The Prime Minister has got to learn to be straight with people because he is undermining public trust and confidence in the government and public health measures at a critical time. Can I also ask what discussions the Secretary of State has had with local authorities, GPs, pharmacies and other delivery partners who will be crucial to this effort? Then there is the shambles of testing. I must say, Mr. Speaker, I thought the Secretary of State might be living on a different planet when he described the availability of testing, because the government's website today states that home testing kits are currently unavailable, pharmacies across the country are out of stock, and even here in Parliament there are no home testing kits available from Portcullis House. No doubt this is due to a surge in demand ahead of the new testing requirements this week, but surely that should have been foreseen. And this is a serious problem. Those coming into contact with positive Omicron cases will not be able to follow the rules and get themselves tested on a daily basis. Those who require tests to undertake home visits risk being left short. Many others need them for work. So how does the Secretary of State plan to ensure there are enough tests in stock and available to everyone who needs them when they need them? And when will this be resolved? It doesn't appear the Secretary of State was even aware of the problem. Absent from the Prime Minister's address last night was any plan to speed up the vaccine rollout for 12 to 15-year-olds. On current trends, some teenagers won't receive their vaccine until February, 5 months after the government's initial target of October half-term. Children have already faced significant disruptions to their education. So will the Secretary of State update the House on the vaccine rollout for 12 to 15-year-olds? Will they receive their vaccines by the end of the Christmas holidays, as we've called for? And of course, Mr. Speaker, patients will be concerned by the news that appointments will be delayed to accommodate the booster rollout. There is no doubt that the booster programme is the right priority. If we don't get ahead of Omicron, the pressure on the NHS will be unbearable and the disruptions to people's appointments in the new year will be severe. But let's be honest, Mr. Speaker, the challenge is made so much greater as a direct result of the government's mismanagement of the NHS for 11 years. We went into the pandemic with record waiting lists, six-figure staff shortages in the health service and the care sector. So where is the NHS workforce plan? Where is the plan for recovery of elective care? And why can this government not understand that their continued failure to fix social care is piling even more pressure on the NHS at the worst possible time? And on social care visits, Mr. Speaker, can I ask the Secretary of State to think again about limits on care home visits? This feels like the wrong decision at the wrong time. Mr. Speaker, I'd like to conclude, if I can, with some words directed to the public. We realise on these benches that the Prime Minister has tested patience by asking people to follow the rules when Number 10 didn't. The Prime Minister's actions in recent weeks have undermined trust at a critical moment. So I say to people feeling let down or lied to, that I do trust the Chief Medical Officer, I do trust the Chief Scientific Advisor, and I do trust the NHS. The Prime Minister might not lead by example, but the rest of us can. And we, the Labour Party, trust you, the British people, to do the right thing, to protect yourselves, to protect the ones you love, and to protect the NHS.
Mr. Speaker, first of all, can I say I heard your request at the start, and if it's okay with you, Mr. Speaker, that's something I'm happy to take up with you directly. Can I thank the honourable gentleman for his support of the need to accelerate the booster programme, and can I also join him in, I'm sure that as the whole House does, to express condolences for the individual that has been the first in this country to die with this new variant, Omicron. Turning to the honourable gentleman's questions, first, the honourable gentleman has asked about the testing capacity. And I would actually like to share more information with the House. There is no shortage of actual tests that are held by UK HSA. There are millions, tens of millions of tests in stock, millions arriving each week. The issue, the limiting factor because of the hugely increased demand, and I'm sure members can understand why demand has suddenly surged, is the ability to deliver the tests and having enough capability to deliver the tests because the current arrangements with Royal Mail alone are not enough. There are new arrangements that are reached with Amazon and other delivery methods, and what that means, there will still be many 100,000 record number delivered each day, but also the number of access points is being increased, including many more through pharmacies and rapidly looking at other access points. I think the honourable gentleman is right to raise this, but I hope he and other honourable members understand there's been a huge surge in increase, and it's not just about the number of tests that are available, it's about getting them through and delivered, both equally important. The other issue the honourable gentleman raised was about the booster programme itself and the timing of that programme. And he's right that just a couple of weeks ago, the plan was to get everyone a boost. This was after the change in advice from the JCVI to reduce the dosing gap to 3 months, and their advice that it should include now everyone over the age of 18. If the plan was to do that by the end of January, for the reasons that I've explained and the Prime Minister shared in his national broadcast yesterday, we want to bring that forward. And what this is working hard with the NHS, and the NHS, by the way, has done absolutely phenomenal work already to reach 4 in 10 adults with boosters and with their vaccination programme in general. It is asking a huge amount of our colleagues in the NHS, and it is our joint view that we can try to offer adults a chance to get boosted by the end of this month. And that does not mean every single person necessarily can get that boost. It requires them to come forward and to take up this offer, as well as everything going right in this huge expansion plan. But again, I hope that the honourable gentleman can respect that the NHS is doing everything it can with the full support of every department of government to throw everything at this, to offer as many opportunities and the maximum possible capacity that there is for delivering on that commitment. The honourable gentleman also talked about the NHS in terms of the challenges that it's facing. I would like to remind him and the House that this year the government has put in an extra £34 billion into the NHS and social care, £5.4 billion of that in the second half of this year, and over the next 3 years there's a commitment to at least £8 billion extra into the largest catch-up fund the NHS has ever seen. In the last year, we've seen almost some 10,000 nurses join the NHS, almost 3,000 doctors. The NHS is increasing workforce, it's increasing capacity, it's looking at new ways to do electives, and it's putting a huge amount of effort into its electives programme and its non-COVID work as well. And then lastly, on adult social care and the limit to visitors, I do understand what the honourable gentleman has said, and it is important, I think, to get the balance right here. We all know the problems that, and the sad deaths that we saw in care homes with this pandemic not that long ago, and it is right to take balanced measures to protect people in care homes when working and listening with those people that run our care homes, and to try to take a balanced approach that allows visits to take place, but it also protects those individuals that are so vulnerable.
Chair Select Committee, Jeremy Hill.
Thank you, Mr. Speaker. 1 year and 5 days ago, the UK administered the first properly approved COVID vaccine in the world, and the government is absolutely right to focus its strategy on immunisation. But Israel approved booster jabs for all adults in September. France approved jabs for teenagers in June, both long before us. The United States has already approved jabs for 5-year-olds, again long before us. Is he worried that our regulators, having been the nimblest in the world, are now taking too long? They are brilliant scientists, they are rightly totally independent, but what can he do to speed up this crucial decision-making in a pandemic?
Mr. Speaker, my right honourable friend makes a very important point with experience, and I think it's fair to say we can be proud of so much of what our regulators have achieved and what they've done. And as he has said himself, we were the first in the world to approve a COVID-19 vaccine. But he's also right to challenge on this and ask what more can be done, especially in light of the circumstances we face. I hope my honourable gentleman can also commend how JCVI, since the emergence of Omicron, and I know they're not a regulator, but they're an important part of the approvals process, about how quickly they reacted in changing the rules around boosters as soon as we learned about Omicron.
We now come to SNP spokesperson Alan Brown.
Thank you, Mr. Speaker. It's worth putting on record that Scotland is the most vaccinated nation in the UK, and certainly would encourage everybody to continue to take up uptake of the booster. Now, does the Secretary share my outrage that his backbenchers last week were literally cheering the proposition that he needs to wait until more people are hospitalised before they'll countenance the wearing of masks in public places? It's absolutely reckless, and it sends the wrong message to the public when they're trying to tell them to take the risk of Omicron seriously. Now, tragically, we know people are now being hospitalised, and we've already recorded, sadly, 1 death from Omicron. So, based on evidence elsewhere, what kind of upward trajectory does the Secretary think there's going to be in terms of hospitalisation? And why the Plan B measures being brought forward, which are already in place in Scotland, is there a pub exemption? Because that makes no sense. Now, given LFTs are only 50% accurate, what risk implications has he assessed in terms of using LFTs to keep people from self-isolating? Surely he needs to consider the minimum being a PCR test and follow the more cautious approach being adopted by the Scottish Government. And why, when LFTs is their key guidance, have they put themselves in this ridiculous position of their website saying they've run out LFT kits? Now, Mr. Speaker, if we're talking about supporting people to self-isolate, then we really need to revisit and extend the levels of statutory sick pay. And so what discussions is the Secretary having with the Chancellor and the DWP Secretary about this? And critically, does he support calls from the devolved nations that they need Treasury support to put in place what restrictions they believe are required to control the spread and impact of Omicron and support livelihoods at the same time? The Scottish Government's already put in place a more generous rates relief to the hospitality industry than the UK Government did, but with trade dropping, suppliers and the trade itself need further support, especially if further restrictions are required going forward. So will they take this up with the Chancellor, and also is the Cabinet considering support for the travel industry? Does he agree that targeted sector restrictions with full financial support is a better long-term strategy rather than the all-or-nothing type approach that we seem to be, and praying that the booster programme alone will be sufficient, because it's going to need a lot more work than just that alone?
Mr. Speaker, the honourable gentleman is right to point to the lag between the point of infection and hospitalisations, and that I think emphasises the need to act early and to act strongly, and that's why the booster programme and that response is so important in Scotland, in England, throughout the UK. It is good that all 4 nations are working very closely together on that. On the lateral flow tests as a way alternative to self-isolation, I think lateral flow tests are the right approach. They can be taken daily, so that individual is tested each day for 7 days, where PCR will be a single test at a single moment. And I just think it's much more flexible, and it's something that's based on advice that ministers have received. And in his questions around economic support, that's something we keep under review.
Andrea Lenson.
Thank you, Mr. Speaker. I do congratulate the Government on the rollout of the vaccination programme. It is impressive. But what does my right honourable friend say to my constituent who says she is now less afraid of COVID than she is of intrusive and incoherent government regulations?
I would say to my right honourable friend that I hope her constituent would appreciate that the government has to act on the information that it sees before it in terms of the spread of this new variant, the rate of spread, the information we now know about its degree of vaccine escape, not just to protect her constituent, but also to protect her constituents' loved ones and her community.
Barry Sherman.
Deputy Speaker, can I say to the Secretary of State, I was deeply shocked when he was in this House recently, and when I said all sensible members of Parliament will be supporting any measure to save lives, and I had boos and catcalls from the government benches. Can I repeat my view that does he realise what a great potential we as members of Parliament in our communities, working for this, rolling our sleeves up, working cross parties with local councillors and local volunteers. This is a real resource, this House of Commons. Please, please, will he use us effectively?
Yeah. Mr. Deputy Speaker, can I thank the honourable gentleman for his call for all members to do their bit to help the nation at this time of crisis. And it's not just what we can all do in this House, but I'm sure he'll agree it's what we can do in our local communities.
Robert Halfon.
Thank you, Mr. Deputy Speaker. My right honourable friend rightly talks about protecting the NHS, but could I ask him if he will ensure that we protect our children as well, and make sure that the schools are kept open in January, that the government sets out a plan for keeping the schools open in January? And given that the Sunday Times suggested that primary school children were going to be vaccinated, will my right honourable friend come in and make a statement, or the Department for Education Secretary of State make a statement about this vaccination programme for younger children, and ensure that there is 100% parental consent?
First of all, Mr. Deputy Speaker, can I agree with my right honourable friend on the importance of protecting our children? And we all know now in this House that how children have suffered throughout this pandemic, and the impact there's been on them, their education, their mental health, their socialisation with other children and many others. And he's right to talk about that importance. And one of the reasons to take the measures that we've said, especially around expanding the booster programme, is to make sure we can prioritise our children. On the issue of vaccination for younger children for 5 to 11. That is something that the JCVI is considering. When the government does hear back from the JCVI on that, that is something, of course, the government will bring to the House.
Sir George Howard.
Thank you, Mr. Speaker. Can I welcome the Secretary of State's statement, and having listened to it and studied the matter in some detail over the weekend, I will be supporting the government tomorrow night with the measures they're introducing. But what would the Secretary of State have to say to those out there in the community who are saying, if the government, the rule makers, can't be trusted to obey their own rules, why should we?
First, Mr. Deputy Speaker, can I thank the honourable gentleman for his support. And I think it's always important to emphasise that these rules, whether what we're discussing now, all rules of any type really, but obviously he's talking about rules around the pandemic, they are there for all of us and they equally apply to all of us.
Hugh Merriman. Thank you, Mr. Deputy Speaker. GPs, particularly those in rural areas, find it difficult and challenging to be able to deliver the booster programme. We'll have to deliver in great numbers. Would the Secretary of State look at measures which will actually speed through the flow for those GP surgeries? And will he also send a message out to all patients out there that they will need to be understanding over the next couple of weeks and ensure that the morale of our GPs who work so hard is not undermined?
Well, first of all, Mr. Deputy Speaker, my honourable friend is right to talk about how hard GPs have been working throughout this pandemic, but also about the need to provide greater support. We expect them and would need them to help with this big new vaccination effort. And I do think there are already signs of many people showing how they understand the need for GPs to reprioritise over the next couple of weeks, and that's important too.
John Speller.
Thank you, Mr. Deputy Speaker. And it's clear from the Secretary of State's statement that he's a considerable improvement on his predecessor. So I'm sure he accepts that COVID is now endemic and variants will probably be returning for years, if not decades. In that case, surely by now, instead of the erratic response we've seen, we should have a well-prepared plan of action and chain of command ready to be activated as soon as a new variant is detected, as well as enough supplies and trained personnel to operate it. So why does his department seem to be continually surprised by the arrival of variants, and instead of a smooth running plan, we have chaos and panic?
Well, Mr. Speaker, there are going to be variants of COVID-19, as the honourable gentleman says, for many years, and indeed there have been many hundreds of variants. And there is no country in the world that is better at surveillance of those variants. May I remind the honourable gentleman that it was the UK that alerted the world to the threat of Omicron. There is no country that is better prepared. If you look at how quickly and swiftly the UK reacted, for example, with its international restrictions, the information we shared with the world on vaccines. So I think the honourable gentleman understands those points. I regret the way he's framed his question.
Steve Brine.
Very much, Mr. Deputy, and I thank my honourable friend for his statement. Many of my constituents will be very surprised indeed to hear from this morning anyone over 18 can walk into a vaccination centre. I wonder if he might give me an update on the Hampshire situation. But could I ask him about the NHS COVID pass being rolled out to 12 to 15-year-olds, which is such a welcome announcement and something that the Secretary of State promised this House that he'd bring back, and I thank him for that. How exactly will that work? Many of my constituents will be travelling within the next few days, certainly within the next week over Christmas. How exactly will they be able to access this pass, given that they cannot access the NHS app the same way as adults can?
Yeah, I can thanks my honourable friend for what he said, and he's right that this is around the COVID pass. It's a very important issue. We will be publishing shortly on the website exactly how that would work, but it's being rolled out as a digital pass in the same way it's working for adults starting today.
Toby Perkins.
Thank you.
Very much indeed, Mr Deputy Speaker. The Prime Minister addressed the nation yesterday, but what he hasn't done is address the NHS in the same way. When I spoke at 4 o'clock to Derbyshire, they were unaware of, they had had no system letter from the Department of Health around prioritisation of vaccines. They were unaware about whether the quality outcomes framework payments were suspended. They were unaware about the Winter Access Fund obligations that they had now been suspended. So can the Secretary of State make sure all of our health providers are informed about these crucial matters that actually give reality in terms of their delivery of these really important messages that he's got in terms of the funding and the priorities that there are for the National Health Service?
Secretary Sajid. Yes, Mr Deputy Speaker, the Honourable Gentleman will appreciate it's a very fast-moving situation. The NHS made the final decision to go on this expansion in the booster programme that I referred to earlier yesterday, and the system letter has gone out today.
Ian Duncan-Smith.
Mr Deputy Speaker, can I just say to my right honourable friend that it's welcome that he comes here today, but I'm concerned a bit about the mixed and heavy messaging coming from the government. The unintended consequences of that can be dire. I noticed, as my honourable friend, the chairman of the Education Select Committee, the Centre for Social Justice produced a report about the huge damage to young children, particularly in the poorest communities, when schools start locking down and shutting them out. Can he please ensure that the message is clear to them that they are not to lock down? And secondly, when I spoke this morning to GPs in my constituency, I asked them, what is the one thing you would like the Secretary of State to do now if you've got to get all these people through? And they said, do we really need to have the 15-minute wait? Can we end that and we would triple our way through this and you would get it going straight away? So can you please act on that now?
I mean, first of all, Mr Deputy Speaker, can I very much agree with my right honourable friend on the importance of never losing sight of unintended consequences. He points to an excellent report by the Centre for Social Justice that looked at that from the past actions that have been taken, and that is certainly not lost on me or my colleagues in government, but he's right to highlight that to the House once again. I hope he does agree, though, with the measures that we've set out so far. They are measured and they are proportionate, and the focus should be on the booster campaign, because that is our way out of this. On the 15-minute wait that my honourable friend refers to, it is being very actively looked at, and I will have something more to say on that, I'm sure, very, very shortly.
Barbara Keeley.
Thank you, Mr Deputy Speaker. The Secretary of State says that there are millions of tests available, but only 9 local authorities out of 153 across England have access to a float stock of 500 PCR test kits to use at their discretion using local knowledge to tackle COVID clusters before they become significant outbreaks. This is very important to disrupt outbreaks and slow down transmission, but it's not available outside those 9 pilot local authorities. Given the importance of slowing down transmission of the Omicron variant, will the Secretary of State agree to authorise the same float stock of 500 PCR test kits to every Director of Public Health and every area to give them the tools they need to fight this variant?
Mr Deputy Speaker, can I say to the Honourable Lady, when I was referring to tests earlier, it's the lateral flow test. I think she's asking me about PCR tests, and I will look into what she said.
Esther McVeigh.
Thank you, Mr Deputy Speaker. Last week's Ofsted report was damning about the impact lockdown has had on our nation's children and the immense harm its students have suffered, with the Children's Commissioner saying schools shouldn't close again. However, it seems that the government has left the door open to school closures after the Christmas recess. So can I ask what specific conditions would need to be met for schools not to open in the new year?
Mr Speaker, I welcome the question from my right honourable friend, and what I would say to her is that with the risk that we see from Omicron at this point in time, with the rise in infections, the increased risk of hospitalisation, the information we have on the vaccines, we think we have taken the appropriate response. It's a balanced and measured set of response. It is designed to protect so much that we love in our country, especially the interests of our children. But the most important thing now to focus on is the booster programme.
Paula Barker.
Thank you, Mr Deputy Speaker. And first of all, I'd like to say that I encourage everybody to be vaccinated and also to have the booster jab. And I'm delighted that the Secretary of State has moved away from passports to having an LFT test if they can't show their COVID pass. And I'd like to thank our front bench for the work that they've done as well. My question is this, Secretary of State. You have talked about the incredible work the NHS is doing and what it will do over the next few weeks. So will the Secretary of State pause the plans he has for mandatory vaccination of all NHS workers and have the conversations with the trade unions and come up with a plan for this to be by consent rather than mandatory?
First, Mr Deputy Speaker, yeah, I agree with her objection. I think the lady had to vaccine passports. That would be a requirement for people to be vaccinated to enter a venue, a high-risk venue. I think it's important that we focus on a test requirement with an exemption if you happen to have the right level of vaccination. In terms of her question on NHS mandatory vaccination, however, I am afraid I have to tell we won't pause what we have already announced, not least because, and this is the view of the NHS leadership as well, not least because Omicron has made it even more urgent that we continue with it.
Sir Edward Lee.
4 weeks ago, I raised the matter of a family member who is aged 90, completely bedbound, vulnerable, at home, still no booster jab. I was promised action, nothing has happened, he's still waiting. And I understand now that there are potentially hundreds of thousands of very old, very vulnerable people trapped in their own home, still waiting for the booster jab, with carers coming in and out all day. And yet we are now offering booster jabs to 18-year-olds who have virtually no chance of falling seriously ill. This is an absurd situation caused by massive delays, bureaucracy, and this ridiculous rule that a doctor has to come and a nurse have to wait 20 minutes with the old person, although there's virtually a minuscule risk of there being any harm. So we need action this day. These people are in danger of dying. Will the Secretary of State now act on behalf of very old people trapped in their own home?
My honourable friend is absolutely right to raise this, Mr Deputy Speaker. Those that are either in care homes, they're homebound, though they have been prioritised. So, for example, I can tell him with care homes, I believe that as of the end of November, 97% of care homes were visited by GPs or other primary care teams to deliver vaccinations. And in cases where they couldn't be visited, it's because that care home itself had a lockdown and they will all be revisited again and again. I know my honourable friend has asked me specifically about people that are homebound. The same approach is being taken, and we will absolutely ensure that every single one of those people, as he rightly says, they are more vulnerable than others. They get the visit and they get their booster jab.
Alan Kayser.
Thank you, Mr Deputy Speaker. I had a busy weekend. On Saturday, I got my booster jab from Margaret, a hard-working staff member from NHS Lanarkshire, and I highly encourage everyone to get jagged and boosted. Then yesterday, I met with my honourable friend for East Dunbartonshire. She is a hard-working and dedicated member of this House, and it is an utter shambles that she is unable to speak and vote. She is, however, doing a power of work in her constituency, is an absolute inspiration for all of us. With the danger of this new variant, will the Secretary of State agree that this House should follow the lead of the Scottish Parliament and move to virtual or at least hybrid proceedings? This could protect vulnerable members, their families, and set a positive example working from home.
Secretary of State.
Mr Deputy Speaker, that is not a matter for my department.
Mark Harper.
Much, Mr Deputy Speaker. You'll be aware, Mr Deputy Speaker, that a couple of days ago the Department of Health published some social media rather jumping the gun on the decision the House is being asked to take tomorrow. And very welcome, the Secretary of State intervened and said no law is decided until Parliament votes on it, and he arranged for that graphic to be deleted. Now, of course, that's not entirely true, because most COVID laws have come into force before Parliament's voted on them, including the mask mandate. However, the question I wanted to ask the Secretary of State is this. The Prime Minister refused 3 times this morning to rule out further restrictions being taken before Christmas. I'm not going to ask the Secretary of State to contradict the Prime Minister at all, but what I am going to ask him is this. If the government does decide to announce further restrictions before Christmas or indeed after Christmas, can I have an assurance at the dispatch box that this House will be recalled to debate and vote on those measures? It's not acceptable to keep governing this country by decree.
Absolutely right.
You've got to involve members of the House. I agree with what the Honourable Gentleman said. Use members of Parliament, which means involving us in the decision, getting this House to make the laws, and then you'll find there'll be much more of a team approach to this, rather than decrees and late-night television addresses without taking the House seriously.
Secretary of State.
Mr. Speaker, first I'd say to my right honourable friend, there are no plans that I am aware of for any further restrictions, and what we are focused on is what I said to this House at this dispatch box last week, that's coming to a vote, and subject to the will of the House, we will see if those become the regulations. In terms of his further question about an assurance, that is something I will take back to my right honourable friend, the Prime Minister.
Daisy Cooper.
Thank you, Mr. Deputy Speaker. 18 weeks ago, on the 9th of August, I asked the government what assessment they had made of using community pharmacies. The response in full was that no assessment had been made. 9 weeks ago, 22nd of October, I asked the government if COVID-secure transport would be available for the clinically extremely vulnerable so they could go to their booster jab appointments. The government said it had made no assessment. 6 weeks ago, I asked the government for guidance for the clinically extremely vulnerable. I asked them to sort out the problems and the confusion amongst third primary doses and the booster jab. And 2 weeks ago, on the same day that the BMJ published data saying that Omicron was more transmissible, I asked the government whether it would renew contact tracing funding for local authorities.